Going back to some of those symptoms, I know you mentioned discharge and you also mentioned odor. Talk to us about itching, because I think that this is something so interesting, because so often my patients are like, I was itching. They assumed I had a yeast infection and I was swabbed for it. It was negative. What has been your experience with vaginal itching and things like histamines or other immune activation playing into vaginal itching or even flow?
Yeah, so vaginal itching and vulvar itching are very different because there's quite a few vulvar diseases that are sort of inflammatory by nature. So if you have another inflammation type picture or an autoimmune type picture, you could very well get vulvar itching and vulvar irritation, and that kind of almost coincides with other flares throughout your body, right? You have other kind of autoimmune flares. So there are women who get, told, yeah, it's probably yeast because they called into the doctor and said, I'm having itching, but never was asked, well, is this on the outside or the inside? Like, what are we talking about? Are we talking about discharge? They kind of get put on the diflucan train, and then they may have had vulvar, irritation from lichen sclerosis or another disease that's autoimmune or inflammatory. And so then the yeast medicine didn't work because it wasn't even a vagina issue. Like they're two different things, vulva and vagina. So vaginal itching, I mean, there are people who get itching because the tissue becomes dry. It becomes, this is very common in perimenopause and menopause, where women start losing hormones. And so when you lose hormones, the tissue becomes very thin, very pale. You lose the plumpness, the collagen underneath the mucosa. You lose kind of those ability to fight infection, the immune system regulation, your pH changes. All these things change, and some women start developing itching as a symptom because it's kind of just irritated in general and not necessarily an infection causing itching. Mm-hmm. So mucosa or vaginal mucosa, the tissue inside the vagina, you can have itching from infection, but you can also have itching from inflammation, and you can also have itching from lack of hormones from it getting so thin